I mean, right now you're in the grind. Everybody's in the grind, and it's kind of you're in the early part of conference season, heading into the middle of it. So you get a lot of overuse injuries. You see a lot of you still see sprains and strains, and ultimately you want guys to be as healthy as they possibly can. So we try to incorporate as many different avenues to do that, whether it's preventative flexibility program. There's a couple of guys that are doing prehab programs, just preventative for weaknesses. Working in conjunction with strength and conditioning. We use massage therapy. We use yoga. Actually, we have a couple of guys that are still doing yoga. So it's a variety of different things that we use throughout the course, right now in particular with the grind, to try to help mitigate a lot of the injuries, a lot of the overuse injuries that we have. Before practice, usually we will start about an hour and a half. Some guys will start as much as 2 hours before practice. We'll work on classes, academic appointments. Guys got to get a chance to get something to eat. Get them in here, and we do a lot of heating. There's a lot of warm tank, hot packs, stretching, flexibility. We have guys that will do simple maintenance programs, whether it be for an ankle, doing a TheraBand program. Most difficult aspect of this job, the grind. I mean, probably is the grind. It's 7 days a week. I mean, Sundays we're off, but we're still doing treatments. Kids are still coming in. Because I think as soon as you don't, you miss an opportunity to potentially recover or get better. I'd say that's probably the most difficult but everybody does it. Staying on top of things, you want to make sure that you're proactive and not reactive in this. When I first started, it was pretty plain and simple. I mean, you were, slinging water and tape, and it was, there was some flexibility. There were some other, I could say medical things that we did, but it was more injury related. The real transformation has become preventative. If somebody comes to campus and it's an incoming recruit, they go through a whole entire screening process, try to identify weaknesses that they may have and address those weaknesses, ultimately try to prevent an injury. So the preventative aspect of medicine has grown exponentially. Now, injuries unfortunately still happen. And with that, we've got a slew of doctors that take great care of us. And from my standpoint, that makes my job that much easier, knowing that if I have to get in with a primary care sports medicine physician, I've got Dr. Convery, Dr. James, Dr. Rabenik, Dr. Rubino, Dr. Barrow. I could keep going doctor. That every need that we have for the guys ultimately can be met. So it takes a team approach, whether it's the physicians. We have a physical therapist, Ryan Lohr, who's in here. He sees patients as well, does a lot of manual stuff. Athletic training, the other athletic trainers here on staff help out, and then strength and conditioning. So it's a holistic approach where everybody sort of plays their part. And then you have to be able to communicate. You have to be able to communicate with Archie, you got to be able to communicate with the staff, communicate with strength and conditioning on limitations. So that's probably been I don't say the biggest, but that's ultimately, I think, where you're successful in this job is if you can communicate. They have to be educated. You have to teach them as far as what's going on, and they have to understand their body, understand what their body's going through. And so that's a big key component, is actually educating the player as to what specific injury is occurring, and then sort of what to expect. What are the steps? What do we need to do? How much of a commitment is going to take on their end to be in here and getting treatment and to be in here and doing rehab? It's that old adage, nobody can make the club in the tub. Nobody wants to be injured. Nobody wants to be in the athletic training room. So you want to educate them. You want to have them do the right things so they can get back out on the court and compete at 100%.